is Bambini Tv.
Bambini, Bambini, I'm a little children, it's Bambini. Come let's learn in various fun, like it's an educational TV show.
Lovely Bambini kids, it's an exciting time again, and as you already know, Bambini show keeps improving and aids in kids development. I welcome you all to the health season. In this episode, we are going to bring you lots and lots of healthy lifestyles for children and even parents. So mummies, daddies and my fellow children, please pick up your notebooks and pens so that you can jot down some important tips. Today we are going to learn how to keep our teeth clean and healthy. So with a huge round of applause for my Bambini kids at home, let me welcome in Dr. Mrs. Louisa. Hello.
Hi, StoneGal.
Please, you're welcome to the Bambini show.
You.
So please, before we start, our Bambini kids at home want to know something brief about you.
Okay. So my name is Dr. Louisa, as most people call me. Full name is Dr. Louisa Anson Santa Clara. I am a dentist or a dental surgeon. What else do you want to know?
Okay, thank you. So as you heard from Dr. Louisa, this is a brief background about her. So Dr. Louisa, please, how did you become a doctor?
So it's something that I've always wanted to do, and I've always known I would be, because my dad, I'm actually from a family of doctors. So my aunties, uncles, my dad, my brother, it's a family of doctors. So I always knew that I had an interest there. And seeing my dad, going to work with my dad a couple of times, I found it interesting what he was doing. So I decided I was going to do it. So I started from school with science-based subjects, and then I went into medical school, dental school, and became a dentist.
Wow, congratulations on that.
You.
Okay, Dr. Louisa, apart from all the professions in Ghana here, why did you choose to become a dentist, and what is the duty of a dentist?
Okay. So as I said earlier, I chose dentistry because of the influence from my dad and my grand uncle, which is my dad's uncle.
Okay.
So even though we have other professions in the medical field, like general medical practice, and other things, I chose dentistry because of that influence from my dad. So the duty of the dentist is to make sure that your teeth are healthy, in a nutshell, but it goes a bit more into that. And sometimes there are other branches in dentistry that deal with not just the mouth, but with head and neck diseases. So we basically ensure the health of your oral cavity, everything else in the mouth, not just your teeth, your gums, like the bony structures and things like that all around in the mouth.
Okay, thank you. So thank you, Dr. Louisa, for giving us a brief background about yourself. And a lot of Bambini kids has been inspired by you, and they are really happy to watch you right now. So our lovely Bambini kids at home, today our topic is tooth decay. So let me come straight to you. Please, what is tooth decay?
Okay, so tooth decay is actually a very, very big topic. If I want to give you the definition, the medical definition, it will bore you a lot. So I'll just break it down in the most simple terms for your Bambini kids to be able to understand.
Oh, okay.
So tooth decay actually happens when there is breakdown of your teeth. And this breakdown of your teeth is caused by acids that are produced by bacteria in your mouth. And these bacteria feed on sweets, things that are sugary foods and things like that in your mouth. So when it's not intercepted or treated early, it becomes a hole in your tooth, and then sometimes can lead to pain. So basically that's what tooth decay is. bacteria in your mouth feed on sweets in your mouth. They produce acids, just like how you and I, when we eat, we have to go to the washroom. They produce acids as their byproduct. These acids attack and destroy the teeth, and then it leads to a hole in the tooth, which is the decay.
Okay. So I hope my mini kids at home understand what Dr. Louisa is trying to say. So Dr. Louisa, please, what can cause tooth decay?
Okay. So as I said, sweets is a very, very important factor in tooth decay. And since my Bambini kids at home, I know a lot of them love sweets.
Yes, like me.
You like you, okay.
Yes.
So that's one of the important factors that I would like to talk about, sweets, because refined sugars, things like lollipop and, you know, toffees and all these sweet things, they the bacteria in your mouth, they love them, so they feed on them. When you keep providing the bacteria in your mouth with all these sweets, they feed on them, and then it gives them more byproducts that are produced, which is the acid. And these acids is what causes the holes in your teeth. Secondly, brushing your teeth. If you don't brush your teeth twice a day, that means that the food that you've eaten gets stuck in between your teeth, including the sweets and all these things I've mentioned. It gets stuck in the hole there. You know, your teeth are not flat. There are some spaces and pits and fissures in there. So they go and hide there, and because you've not brushed your teeth, the bacteria would feed on it and then cause the tooth to decay. So brushing and then flossing. Flossing is, there's this thin thread called floss that you're supposed to use to clean in between your teeth, because you know the toothbrush cannot fit in between the spaces between your teeth. So you need to use the floss to clean in between your teeth. So if you don't floss, you don't brush, you make your mouth a very, very conducive environment for tooth decay.
Okay. So Bambini kids, as you heard, Dr. Louisa said that when you eat more and more of sweets, the sweets depend on your teeth, so it can cause tooth decay. So let's continue. Please, what are the signs of tooth decay in a child?
Okay, so in the early stages, it starts as a white spot lesion, so it looks like an overly white part of your tooth. Then it can progress to become a brown or a dark spot. So you see like some brown, some people you see some brown things on their teeth. That means that the decay is starting. If it's not treated at that stage, it actually becomes a hole in your tooth. Now, if that hole is not treated early enough, the hole travels further down into the tooth, and then it becomes painful. And when you start having pain, you know that it's a bit too late, because now mommy and daddy will have to spend more money to get your tooth fixed. That is why we always advise that kids should see the dentist twice in a year. That means every 6 months. Because when you go to see the dentist every 6 months, your dentist will check all your teeth and then be able to detect if you have a cavity or decay starting, and then the filling will be done for you, professional cleaning will be done for you, so that your mouth and all your teeth are healthy. But if you don't go to the dentist and you have decay in your teeth and you wait at home for all that time, it will start to hurt you, by which time it will be too late and maybe the doctor has to take the tooth out. So these are some of the ways that you can detect decay. I can show you here on this diagram. So here, this is how your tooth looks like. So the tooth is made up of 3 different layers: the enamel, the dentin, and then the pulp. The enamel is the outermost layer that you see when you open your mouth, the white part. Then beneath that is the dentin, which is usually covered by the enamel. And then the innermost layer is the pulp, and that's the part that has the blood vessels and the nerves, and is responsible for reception of pain and things like that. Now, when you have tooth decay, as shown here, so this black stuff means that the person has eaten so many sugary foods, sweets, and all of that. He's not brushing well enough, and so bacteria in his mouth that have released acids have caused the tooth to decay, and then the decay has gone all the way down through the enamel into the dentin. So in this person, whenever they eat anything hot or cold, or they eat certain foods like oranges and pineapples, there's extreme sensitivity, like a shocking sensation in the mouth. That means that the cavity has gone down into the dentin. Now, if the cavity travels all the way down into the pulp, as shown here, in this case the person's cavity is on the side of the tooth, so it has traveled through the enamel, through the dentin, into the pulp, then the person starts to feel pain because the blood vessels and the nerves here have all been affected by the tooth decay. So these are all some of the effects that tooth decay can have on you. It can cause extreme sensitivity when it's in the dentin, and then it can cause extreme pain when it enters the pulp. That's why you have to see the dentist early when you start suspecting that you have a cavity in your tooth. You need to go early enough so that it doesn't come all the way here. If not, you would have an infection. See here, the cavity has traveled all the way down into the bone, and then there's pus over here. It's called an abscess, and so the tooth may be taken out by the dentist, or you have to do what you call a root canal, and you pay a lot of money for that. Or your teeth will be taken out and then it will end up like this, and I know you don't want that. So please make sure you go and see the dentist anytime you suspect a cavity in your tooth.
Oh wow.
Yes.
Dr. Louisa deserves a round of applause. So, you see, like me, I like sweets. So, as she said, I must come for checkup or...
Yes, every 6 months.
Okay, okay, I'll come. Okay. So, as she said, at what age does a child experience tooth decay?
Okay, so once you start to grow teeth into your mouth, you are eligible for tooth decay. So that's why we always advise parents and mothers, especially when you start having kids and then the kids start growing teeth into the mouth, immediately you have to start caring for the teeth by brushing the teeth. When there are no teeth, you use a washcloth and then clean the gums and then the tongue every day. But once the teeth start to grow into the mouth, you need to brush the teeth with the children's toothbrush and the children's toothpaste, because as soon as teeth start going into the mouth, they become eligible for tooth decay.
Oh, okay. So, like as you said, if let me take it as I recently born and my child doesn't have teeth. So when she like starts growing teeth,
yes.
Can she have tooth decay?
Usually at that age, because the child is not eating sweets and things like that, you hardly have a newborn baby having tooth decay. Once they start eating, we start feeding them, and then you start giving them all the sweets and all of these things. Kids as little as 2 years and 3 years sometimes develop tooth decay because they are being fed too much sugary foods and the teeth are not being cleaned enough.
Okay. So let's take it as right now I have tooth decay. What can I do, or what should I do to prevent the tooth decay?
Okay, so if you already have tooth decay, you need to tell mommy and daddy to take you to see a dentist. Okay, if you start seeing any brown things on your teeth, or you start feeling sensitivity anytime you drink cold water or your hot tea, or you eat oranges and you feel a sharp, shocking sensation in your teeth, you need to tell mommy and daddy so that they take you to see a dentist so that your cavity can be filled for you. Now, ways to prevent the cavity from happening: cut down on the sweets. No toffees, no sugary foods. You can replace them with fruits. If you feel like eating something sweet, tell mommy and daddy you want to eat something like oranges and pineapples. Those are a better alternative to sweets. And then, of course, brush your teeth twice in a day, in the morning and in the evening as well.
Okay, thank you. So, our mini kids at home, if they have tooth decay, can it affect their learning?
Definitely, tooth decay can affect you in all areas of your life because it can become very painful. You can't sleep at night. When you go to school and teacher is teaching, because your teeth are hurting you or your tooth is hurting you, you can't pay attention. You are thinking about the pain, or you need to rest and sleep to be able to get your mind off the pain. So it can affect you, it can affect your learning, it can affect you in so many areas of your life. And if you've ever experienced tooth decay before, you know it's very, very, very painful because the space there is very small, and when there's an infection, the blood vessels and things like that are really throbbing. So it's encapsulated in a small space, and then there's a lot of pain.
Okay, so can our tooth recover from decay?
Yes, if you're able to see the dentist on time, your dentist can help you to recover from it. The right things will be done. Cleaning will be done for you. The cavity will be filled, and then you'll be back to normal.
Okay. So, Dr. Louisa, please, thank you for taking us through the process of tooth decay and showing us the things that can cause tooth decay. So, please, what are your closing message just for our Bambini kids at home, parents, and also me?
Okay, so my Bambini kids, you guys are doing an amazing job. It's great that you always tune in to the Bambini show and learn something new every time. I want your teeth to be perfect, so please make sure you brush your teeth twice every day. You brush your teeth in the morning, and then you brush your teeth again the last thing you do before you go to bed. Make sure you brush your teeth. And then also please cut down on the sweets. The lollipops, the toffees, and all the sweet sugary foods. Make sure you cut down on them. And then you eat more fruits and vegetables. These will all help you to have perfect teeth. Make sure you drink your milk and all these other things to make sure you are in good health all the time. I love you guys, and I want to see you in my clinic or in any other dental clinic for your checkup every 6 months. When you realize that it's 6 months into the year, tell mommy and daddy I need to go and see the dentist because Dr. Louisa said I have to check my teeth every 6 months. You can follow me on my social media pages. I share tips on oral health every Tuesday. My handle is at Dr. Louisa_S on Instagram and on Twitter. And then my YouTube page is Dr. Louisa, where you can subscribe and learn something new every Tuesday on oral health care.
Okay, so as you heard from Dr. Louisa, she said, please follow her for more and more healthy lifestyles. And thank you for making time with us on this exclusive and educative journey on the Bambini show. So if you want to ask more questions or you have more questions for Dr. Louisa, as she said, follow her at Facebook and Twitter at Dr. Louisa_S and YouTube at Dr. Louisa,
yes,
so that you get more and more healthy lifestyles. See you next week with more and more healthy lifestyles. Bye-bye.